Hi, this is Jessica DeMassa at the HISA Studio here at HIC 2017. I'm here with Louise. Louise, introduce yourself.
Thank you, Jessica. So my name's Louise Teo. I'm a medical registrar from Melbourne, and I run a blog on medical entrepreneurship called medicalstartup.com. I interview people who work in healthcare and out of healthcare about their entrepreneurial pursuits, including in digital health and non-medical industries.
That's fantastic. So I want to pick your brain about the digital health startup community here in Australia. So what's going on right now? What kind of startups are you seeing? What kind of applications do they have?
There's heaps we're seeing. So I just talked about a VR application coming out of Melbourne, which is aiming to help paediatrics, so kids going through cannulations and needles. So they play videos of underwater animals and animations made from a studio that's worked with Disney. And those videos are meant to help prepare the kids for those needles and reduce the pain and distract them from the pain of needles. And we've also seen a lot of apps helping with cancer. So you would have heard of Cancer Aid, a Sydney-based startup that helps people through the cancer journey. We've seen a lot of apps in terms of EHRs and messaging and better solutions for doctors, patients and clinicians across the board. And we've also seen a bit of, we'll be seeing more AR as well, I believe, in the next few years.
Good, okay. And what's the startup community like here? Is it very robust? Tell me a little bit about what's going on big scale.
Okay, so the major capital cities are starting to grow more with the digital health startups. So Melbourne's kind of a capital of digital health at the moment. We've got the Melbourne Health Accelerator at the Royal Melbourne Hospital. We have a few medical-related incubators and accelerators that are happening in Sydney and Brisbane and even WA as well. So Western Australia will be introducing one soon. We are going to hopefully see more in the rural areas one day. I really hope that happens soon, given that I work in rural a lot. I see how disadvantaged they can be from not having access to the resources that people in the city have. We're seeing a lot of accelerators in general, not just in medicine, and that can be quite helpful. A lot of healthcare startups do come about from those general accelerators and programs as well.
How about the investment community? Are there a lot of VCs out here, or what kind of funding can startups look forward to having or not having here?
From my understanding, I'm pretty new to that area in terms of knowing about the VC landscape, but there are, from what I've heard, a lot of angel investors, and I believe that successful entrepreneurs in other industries, such as Mike Cannon-Brooks from Atlassian, are helping to fund successful startups and take the VC industry to the next level. There's Blackbird Ventures in Sydney, there's local VC companies in firms in other states as well, and there's a lot of bridges trying to be built between Silicon Valley and Melbourne and Sydney and other cities as well.
That's great. Are you finding that within the big healthcare, like the healthcare institutions, like the hospitals or the government agencies, what's their appetite for startups and integrating them in either as pilots or things like that? What's going on there?
That's a good question. So it does depend on each institution. It really depends on an individual institution, really. About people are waking up to, not just waking up, they are embracing innovation and startups and technology more, and within their institutions there's a lot of entrepreneurship going on. It just is a matter of timing and a matter of each individual institution being receptive to startups and change in their industry.
Fantastic. So one last thing from you, give us some good advice. Okay, so for any of those startup entrepreneurs that are out there and want to get into healthcare, what's your best piece of advice for them?
Okay, have fun. Well, think about the patient first, so patient/consumer. We've all been patients and consumers, or even if we haven't been patients, we're all consumer advocates, we're all patient advocates in ourselves, and no matter what our industry background is, even if we're not in healthcare but want to get started in healthcare, I think any of us can start. Be open to empathy and to asking what the consumer or patient needs first, and never be afraid to ask questions and learn as much as you can, and to make friends and to learn about other people as well.
Fantastic. Louise, tell us again what your blog is called.
It's called themedicalstartup.com.
Fantastic. Thank you so much for joining us here in the HISA studio. I'm Jessica DeMassa. Thanks.